Hey, good afternoon. Wanted to begin by letting you know Supervisor Greg Cox is not able to be here today. He had a family emergency. We do expect him back on Monday, and we wish him and his family all of the best. Second thing is we have a little change in our format today. We essentially have two different press conferences that are going to happen back to back. Myself and Dr. Wooten will be providing an update on the coronavirus response. We will then be taking any COVID or coronavirus-related questions. At the conclusion of that, Sheriff Gore will be here to provide an update on the law enforcement situation, and then the sheriff will be here to take any law enforcement-related questions immediately following, and we will run the two of these back to back. We've talked throughout the process that our reopening would be in phases. We would take a step, monitor the impact daily, track the numbers and metrics, and in particular the triggering entities which we've shared with you. If we see success, then we'll be in a position to take an additional step. It was just a week ago, this past Tuesday, that we amended the public health order to take a step on beaches, where we freed up the ability to sit and sunbathe on beaches using chairs and towels with members of your own household. We have worked with our coastal mayors and lifeguards and city managers, and it appears that that implementation has gone very well. People are maintaining physical distancing, and they have been able to enforce that. And because of that progress, we are prepared to take another step as it relates to beaches. This will not go in effect until next Tuesday, June 9th. Some folks ask why Tuesdays. The cities and lifeguards have asked to get through the weekend. They want to use Monday to update their signage and prepare for the implementation. And then on Tuesday, it will be in effect. But we will be amending our public health order that will allow, we do not require local cities or state beaches to do this. It is their decision to implement it, but they will be able, if they choose to change their posture around beaches starting Tuesday, June 9th. And I believe we have a slide representing these changes you can see right there. So starting Tuesday, June 9th, local jurisdictions are free to open their beach parking lots and allow active sports and active recreation with household members only. Again, the local jurisdictions, the cities and state beaches and parks will decide when, and they can decide exactly how it is they want to do. They can be more restrictive if they choose, but the county public health department is removing any of these restrictions on beaches going into effect Tuesday morning, June 9th. The second part of our guidance, which we've talked a lot about, is, let me take that slide down. The second part of update around reopening certainly surrounds our efforts around reopening our businesses. The governor, again, has consistently said we will move in phases. We will take a step, monitor the impact, and be in a position to take another step. The governor also has provided greater latitude over the preceding month to counties in terms of making determinations. We've covered with you many times in the recent days the state would put out guidance, and once the guidance was socialized, it would be up to counties to decide when exactly they would like to implement that. We have received word from the state of California that at some point today, perhaps later tonight, they will be releasing a series of guidances around new industries and new entities that will be allowed to open at the county speed no sooner than June 12th. And so I'm going to share with you now what those guidances are that we expect to come out today, hopefully tonight. That would be guidance around gyms, around day camps. We believe there will be opportunities to include some youth sports activities, possibly into the day camp criteria and framework, guidance around campgrounds, hotels, card rooms, family entertainment, bars and wineries, zoos, indoor museums, film and TV production, and professional sports. Again, we expect this guidance to come out from the state of California today. Again, it would be moving no sooner than June 12th. But that gives these businesses and industries about a week to look at that guidance, look at our safe reopening plan on our county website, and begin the thought process to prepare to move no sooner than June 12th. Over the weekend, we will evaluate the guidance that comes out, continue to monitor our situation, and we think we'll have more updates throughout next week around the timeline for when we'll be able to do it. But again, another positive step for our region moving forward. Now we'll jump into our daily updates from today. Today we're reporting our single highest day of testing throughout the coronavirus pandemic. I want to preface it by saying we had a kind of dump of results that represented a couple days. And so even though we're at 5,936, it does not mean we will be at that number every single day. We are working diligently to increase our daily reporting totals, but there's always going to be day-to-day fluctuations in the numbers. But our 7-day average is now over 4,000 at 4,345. And we have some challenges with the state test reporting system, and so we're working through a number of those, but we expect our daily testing numbers to continue to increase. But again, today we're reporting our single highest day total in testing. Contact tracers are now at 431, getting very close to that goal of 450. And then you see our public health motel rooms that are available for treatment. Along with and consistent with our single highest day of testing, today we're reporting 240 new positive tests, which is our single highest day of tests. But again, it's really important to put the number of positive tests in the context of the total tests that were done. And so as that relates, it is only 4% percentage of positive, which is a little bit higher than our 14-day rolling average, but not presently a cause for alarm. Same percentage positive as we had yesterday, 1 percentage point higher than the days before. But again, you can generally see that 14-day rolling average holding reasonably flat and steady as we move forward. As we continue to see more tests being done on a daily basis, we expect to see more positive results. And again, the important indicator there is the percentage of positive, which tells a more complete picture than just the number of positives. Our daily hospital census, again, is holding reasonably flat, 153 in ICU, 379 total ICU, a few less than yesterday. Total COVID hospitalization, a few more than yesterday, but again, you can see over the last month holding relatively stable and flat. Next, we're going to look at our ICU bed capacity. We had a little uptick in the non-COVID ICUs, which made our ICU bed capacity jump a little bit to 71%. Again, one of our triggers is 80%. There are some day-to-day fluctuations you see here. You can see the ICU holding flat as it relates to COVID, and a slight increase yesterday to today, which accounts for the uptick in the percentage being occupied. Certainly something we will keep an eye on. And then my final chart for today is just the total hospitalization. At the bottom there, you see the ICU COVID-related patients, and then in the blue, you see the non-COVID-related patients tipping just over 4,000, but more than 800 beds short of that 80% capacity, which is also a trigger that we assess and use. As we head into the weekend, we really want to encourage everyone who is out for any purpose to please exercise caution. Please utilize face coverings, utilize physical distancing as best you can. We want to continue our forward progress. We have done really well as a region. The numbers have been reflective of our efforts and the intentional focus and steps we've taken. And so we definitely want to make sure that we stay in a posture and position where, based on the triggering metrics, we can continue to reopen, and we want to do that smoothly. And so we again encourage everyone who is going out this weekend to please exercise as much caution as possible, utilizing face coverings, physical distancing where you can, hand washing, and then, of course, for those folks going to work, the temperature screenings for employees. With that, I'd like to turn it over to Dr. Wilma Wooten for her Public Health Officer's report.
So thank you, Supervisor Fletcher, and good afternoon, everyone. Thank you for being here. The global, national, and state statistics for COVID-19 are based on data that we retrieve every day around noon from the Johns Hopkins dashboard. Information is as follows. Globally, there are almost 6.7 million positive cases, including almost 400,000 deaths. Nationwide, the United States is reporting almost 1.9 million positive cases, now at 28% of the global number, and includes almost 109,000 deaths. Statewide, California is reporting over 123,000 positive cases, which includes 4,458 deaths. And today, the County of San Diego has reached another milestone with over 8,000 cases. Today, we were reporting 8,180 cases, which is 240 more cases than yesterday, as well as 294 deaths, which is 6 new deaths reported since yesterday. And as cited by Supervisor Fletcher, the 240 more cases, again, is as a result of several days of testing that we received from one location. The average age of cases is remaining at 3 months to 102 years of age. Uh, The age group from 20 to 49 years of age represents 53% of the total number of cases at 4,303. The gender, now females are edging out males, now at 51%, and 49% are male. There are only 10 individuals with no gender identified. There's 1,397, or 17% of cases have been hospitalized, and of the hospitalized number, 397, or 5% of the total number, have been admitted to the ICU, and this 397 represents 28% of the total number of hospitalized cases. As of June 4th, the county has surge capacity for hospitalization at 34%, for hospital capacity, and 29% for ICU admissions. The 294 deaths represent approximately 4% of the total number of cases. Of the 6 additional deaths reported since yesterday, the dates of these deaths occurred between May 16th and June 4th. The age range is from 46 to 94 years of age. Of all of the 294 deaths, 42% are female and 58% are male. 280 had underlying medical conditions, which is 95% of the total number of deaths, and 13 had no underlying medical conditions, or 4% of the total deaths. And there is still one individual for which underlying medical condition information is pending. Regarding race and ethnicity of all deaths, we have data for 98%, or 287 of the 294 total, which means we do not have the race and ethnicity data for 7 cases. Of this total, for which data is available, 124 or 43 are Hispanic or Latino, 123 or 43% are white, 28 or 10% are Asian, 8 or 3% are African American or Black, and 2 or 0.7% are Pacific Islander, and then 1% representing 0.3% is American Indian, and the same is for multiple races, 1 or 0.3%. And as usual, our sincerest sympathies and condolences go out to the families and friends of those individuals for whom we reported today that have lost their lives to COVID-19. So all of our statistics can be found on our website, which is at the bottom of most of our slides and in the sign in front of me. And since the beginning of the COVID-19 pandemic in San Diego County, there have been 93 outbreaks in congregate settings and community settings. Of these 93 outbreaks, 40 or 43% are now closed and determined to be inactive outbreaks. And this means that there have been no cases at these sites for the last 14 days or longer. Now we have 53 actual active outbreaks, and we have stratified those into 3 categories. 19 or 22% of the total 53 active outbreaks are in our San Diego County's skilled nursing facilities. We have had no new outbreaks reported since yesterday in this group. There are 23 active outbreaks in other long-term care congregate settings. 2 more outbreaks became inactive since yesterday, and we have not had any new outbreaks reported since yesterday. This group has generated 842 cases, which includes 66 deaths. Lastly, there are 11 active outbreaks in community settings. 2 more outbreaks became inactive since yesterday, and no new outbreaks have been reported since yesterday. This group has generated 365 cases, including 5 deaths. As shared Tuesday at the Board of Supervisors meeting, the county now is continuing to monitor triggers for modifying the health office's orders as needed. And as everyone should now know, we have 13 triggers that are being monitored. And just as a point, the increase in cases reported today as a result of the holdover of positive tests reported today artificially increased the first trigger, which was cases. But again, that was due to increased testing associated with those cases not being reported when they should have been. So to date, all of our triggers are still green, and we have no areas of concern. So on Wednesday, the county launched a dashboard for the 13 triggers, and you can find that on our website, the same website before me. Additionally, we will soon see additional guidances, as Supervisor Fletcher acknowledged, that will be posted on the state's website, and as those guidances are available, we will report or let you know what the process is, but the guidances, the state is recommending that they become effective as of June 12th. And then lastly, the state also is launching a dashboard that includes 6 metrics, many of which are in our triggers, as well as our metrics that are being monitored as an attestation variance county. Locally, the county must continue to be vigilant and maintain strategies to decrease the spread of COVID-19, which includes hygiene and sanitation, facial coverings, distancing, social distancing, and screenings. All of these are very important as we reopen and increase the businesses and industries that are coming back online. Lastly, as the health officer, I am urging testing for all protesters and anyone involved in the cleanup after the various peaceful protests that have been occurring around the county. And anyone with symptoms should also get tested. It is very important that people adhere to these recommendations. Now, please welcome back to the podium Supervisor Fletcher.
Thank you, Dr. Wooten. At this time, we will go to our call-in questions. And
with KPBS. Please state your question. Shalina, are you there?
Hi, sorry, unmute me. Hi, yeah. So earlier this week, you all had mentioned that there was some unrest in Sacramento, and that could have maybe been delaying shipments of personal protective equipment. What's the status of that? And I know that's one of the triggers for going back into a lockdown. So what's the situation there?
yeah, those systems are back online, and the shipments are have picked back up. So we think we're in a good place there.
So what's the situation there? Great. And also with the homeless population, we didn't get an update on number of cases there. What's the situation with the homeless population?
Yeah, so the city, which is running and administering the convention center, is posting the results of the test surrounding the convention center. They have that available on their website, and we would direct you there. We do have a weekly summary that we provide around the total number of positives as it relates to the entire homeless population, not just the convention center, and we can share that with you as well. Next question.
And Shalina, you can come back on for the next topic.
While we wait for the next question, just to remind everyone, we're going to address all the COVID coronavirus-related questions, and then the sheriff will come up to make some remarks about the law enforcement situation, and then he'll take questions related to that. So next COVID question.
Priya Shriver with NBC7. Please state your question.
Hi there. It's probably too soon to be able to tell if the demonstrations that are happening now will translate into a spike in cases, but it has been a few weeks since Memorial Day, which is when we kind of started to see a lot of people going outside. Have you seen an increase in cases that might be attributed to the holiday weekend?
Well, I'm going to let Dr. Wooten address that. I'll just tell you that the totals that, again, we see as a percentage of positive continue to be relatively stable. So that is encouraging. But we certainly do continue to advise everyone, whether they're the protests that happened a month or so ago or whether the ones happening now, to continue to utilize face coverings and physical distancing as best they can. But as it relates to specific cases tied to specific events, I'll have Dr. Wooten address that.
Thank you for the questions. The protests that occurred in May, we have not identified any cases. It doesn't mean that none have occurred, but we have not identified any associated with those events. It's a bit soon to tell about the events that have occurred since this past weekend. So we would expect to see any associated new cases related to those events in about 12 to 14 days.
Thank you.
Thank you. We'll now go to our last call-in question.
Paul Sisson with the Union Tribune, please state your question.
Hi, thanks for taking my call. I've got some questions about what's going on today with some of our local hospitals. I spoke to Scripps Health a little earlier. They said their two Mercy campuses in Hillcrest and Chula Vista have hit the pause button on admitting additional COVID patients due to some stresses on critical care staff. I also heard from El Centro Regional, which said they were on a several-hour ambulance bypass yesterday due to a surge of patients that they attribute to Memorial Day. And so I wonder what the county makes of this in terms of an increase that our hospitals seem to be reporting. It seems like with the batching that's going on with the test results coming in, it seems like perhaps we're not getting a real-time view of when new positive cases are actually testing positive.
Great, thanks. We'll start with Dr. Wooten.
Hello, I'm not Dr. Wooten, but with the Medical Operations Center, we are monitoring all the patient movements, and there's an all-access transfer center in Sacramento that is coordinating the movement of patients in Imperial County to other counties as well. So when you say the Imperial County hospitals are going on bypass, they're just moving the patients to other counties. So thank you.
Right. Yeah, I talked to Scripps today, and they said they've seen 11 transfer county hospitals in the last 2 days alone, and that seems to be part of what's putting a bit of a stress on their critical care staff. So I just wonder, how the county's responding to this.
Well, Paul, hi, this is Dr. Wooten. Thank you for the question. We continue to monitor these closely, and our system is set up that when there is a stress point, there's an opportunity to relieve that stress. So any number of hospitals may be on bypass at any given point in time. And there are situations where there are critical stress points that occur, but eventually these things work themselves out. So we are monitoring what's going on, and we'll continue to do so.
Thank you. We'll now go to our text questions.
Yes, this first question is from Marilyn Hyder with Kogo Radio News. Dr. Wooten said she would like all of us to be tested for coronavirus. What about antibody testing? Is that available widespread for the public as well?
Okay, I'll have Dr. Wooten answer that.
Hi, thank you again for that question. Testing is important for us at this time to figure out what's going on in the community, but that's diagnostic testing with PCR. We do have our laboratory testing task force, and there is a work group focused on serology testing that hopefully soon we will have a strategy worked out for how we will address serology testing here in San Diego. But right now our primary focus is on diagnostic testing with the PCR.
And Dr. Wooten, if you don't mind, I have one more question from Mike McKinnon from KUSI. What does the data show that made you decide to ban passing a ball on a beach with your friend?
Well, that's not about what the data shows. That's just kind of common sense. If you have a household living together, they are sharing the same germs. But if you have them interacting with other households, other families, or other individuals, there could be an introduction of the virus that way. So that's why our health officers' orders have focused on household members. If you're in a car for graduation, just household members, not even family members, household members. So that's the rationale for that.
All right, that concludes our coronavirus update for today. I'm now going to turn it over to Sheriff Gore to give you his update, and then the sheriff will be available for any questions for him. Thank you all. Pardon me.
Thank you, Nathan. I think I've talked to most of the local TV and radio stations in the county and the TV stations one-on-one. I just didn't want to take this opportunity to, on Friday, here at this press conference, to talk to everybody that might be watching and listening all at one time. I'm dressed like this because I just came from a virtual Sheriff's Academy graduation. And I obviously told these new graduates that they're coming into their law enforcement career at a truly historic time in the middle of a worldwide pandemic and civil unrest that we haven't seen for probably decades in this country here and really literally around the world. I reminded each one of them that when they put on that badge, that they're responsible for, protecting everybody in this community. And I talked to them about the courage that takes. But I think more importantly than the courage, it really takes compassion. And that's what I tried to express to these new deputies. I think we all have a vested interest as we look around the demonstrations, the peaceful demonstrations we've seen in our communities, region-wide and really around the country. We all have a vested interest in how we make change in this county and how we come together and listen to each other and make that change. And it's going to be change, and we're going to talk about the future of policing, probably not only in this county, but in America. When I look at the peaceful protests that I've seen growing around the county, it makes me really proud, and I'm sure that our fellow San Diegans feel that same pride. And I said it before, and I want to say it again, the Sheriff's Department strongly supports your expressing your First Amendment rights through these protests. We've seen, especially noticeable to me, was the younger people in these crowds and their energy and their passion. And this is the next generation. These are the people who are going to be making the change. And I saw a lot of that same look in the new deputies that graduated just about an hour ago. And the one thing I see in common is they both have hope. Hope that we can come together, listen to each other, respect each other, and make that change. As your sheriff, I'm committed to continue to listen, committed to making those changes, because I know that change is here. We're at that point in our time where policing is not going to be the same in a year or two than it is right now. And I'm committed to work with the communities that we serve, to listen and to make those changes. Lastly, I'd just like to say that I think we need to remember that the police officers and the deputies in this county and all over the country, when they go home at night and they take off their uniforms, they're your next door neighbor, they're your Little League coach, they're the people you go to church with. And if we keep that in mind and we continue to talk and respect each other, these changes will not only be long-lasting, they'll be meaningful changes. So having said that, I'm committed to continue to listen, as is my department. We expect to be held accountable. That's understandable. And if we're making mistakes, we can always improve. But that's where we are, and that's where I want to move forward from that position of being held accountable and being constructive in the changes we make. And if you have any questions, I will be more than happy to answer them.
Shalina Shatlani with KPBS. Please state your question.
Hi, Sheriff Gore. I have two questions. The first is that Governor Newsom announced today that he would be working with legislators to create statewide standards to respond to protests. What do you think the impact of that is going to be on your department? And I'll get to the next question after your answer.
Thank you. You know, I hate to speculate because I don't know what those changes are going to be. I would hope that, and I would look forward to working with the governor and members of our community to address those changes. Like I say, we need to, always consider better ways to do things. And if the governor or the legislature and community activists that we've seen have better ideas, better suggestions, I'm all ears and I want to work with them to try to make those changes.
Great. Another question that we've sort of brought up in interviews, and I'm sure other institutions have brought up as well, is whether there's going to be any video footage or evidence released of more dangerous projectiles that were thrown by protesters, or allegedly thrown by protesters, like rocks at the police. It's still unclear whether that actually happened before tear gas was used.
Yeah.
So will any of that be?
Well, yeah, there's investigations going on of individual acts. As I think I was talking to KPBS, I would refer you to, I think it was Channel 8 video I was watching on TV before any less lethal munitions were dispersed, whether it's gas or not rubber, bean bags or pepper ball, that the porch of the La Mesa Police Department was littered with rocks, bricks, and bottles that had been thrown at La Mesa police officers and deputy sheriffs. So I think that's readily available on public TV channels that I was watching, some of the aerial shots of it. But there will be ongoing investigations of individual cases, I'm sure, and as appropriate, those, the body-worn camera or whatever will be released.
Thank you.
Thank you.